Hello, I'm Dr. Eric Lavonis. With me today is my colleague, Dr. Sahafum Sursuma, and behind the cameras, Dr. James Cow. Welcome on behalf of the Rocky Mountain Poison and Drug Center and the Rocky Mountain Pediatric Environmental Health Specialty Unit. We're here to speak with you today about lead poisoning. The target audience for today's talk are physicians and advanced care practitioners, pharmacists, and public health professionals who are called on to assess and treat patients with possible lead poisoning and lead exposures. At the conclusion of this presentation, we hope that you will be able to describe common sources of lead that are responsible for lead poisoning, describe the pathophysiology of lead poisoning, and common diagnostic and therapeutic approaches used to manage lead poisoning. This presentation was prepared on behalf of the American College of Medical Toxicology and funded from the CDC's Agency for Toxic Substances and Disease Registries, and there are some disclaimers noted here.
So for the outline, we're going to talk about the overview of the lead poisoning, pathophysiology, clinical manifestation, investigation, screening and follow-up, and the treatment. For history, the Greek physician from century before Christ observed the adverse of cognitive effects from infant womb of the lead smelters. Benjamin Franklin also observed the dry grips or abdominal colic and dangers or the clinical of wrist drop that affect the tinker, painter, and typesetter. In 20th century, there's high rate of stillbirth and infertility and abortion among the women in the pottery industry or the women who were married with the pottery workers.
So lead is still common in our environment. The most common situations in which people are exposed to lead is when they are repairing specific parts of automobiles, particularly radiators, and reclaiming lead from lead batteries in cars. Leaded fuels are still used some in the United States, though much less than they used to be. There's leaded crystal and glass and ceramic glazes. Lead smelters and refiners, any place where lead is heated is a potential source of lead exposure to the workers and to the people around them. This includes mining and metallurgy. And metal welders and cutters can be exposed to lead. Lead is present in older paints, and sometimes we see patients exposed to lead from paint, either when the paint breaks down into dust and flakes that people eat or inhale, or when people are remodeling and they're heating and scraping old paint to get it off. Shipbreakers, that is people who take old ships and break them down into component parts for recycling, are often exposed to lead from welding, electronics, and paints from old ships. Battery recycling and reuse is a very dangerous industry for lead poisoning. Lead is, of course, present in bullets. People with retained bullets can sometimes develop lead poisoning as they absorb lead from the bullet. Also, people who reload and people who spend a lot of time, typically workers on indoor firing ranges. Lead is used in the manufacture of PVC pipes, though the pipes, once they are manufactured, aren't really a danger. Again, minors. And we see lead come in herbal medications, spices imported from other countries, and cosmetics from other countries.
For pharmacokinetic, the absorption is higher in children more than adult, about 3 times. The main route of absorption is pulmonary. It's about nearly 100% in kids, whereas it's about 30% in adults. The oral absorption in kids is about 40 to 50%, whereas the oral absorption in adult is about 10 to 15%. The oral absorption is going to be higher in calcium, iron, or zinc deficiency people. The distribution of lead is going to go to the bone. So the kid have less bone mass, so 70% of total body burden is going to go into the bone, whereas adult have more bone, so 95% of lead burden is going to adult bone. It means that there's also free lead circulating or go to the vital organ more in kids than adult. The major route of excretion is in urine. Lead can also cross the placentas. For pathophysiology, lead from complex with several ligands, especially the sulfhydryl group, which is in the proteins. And protein act as enzyme, receptor, and structural. It also interfere with calcium and zinc mediated metabolic pathway.
So it's important to remember that lead, unlike, say, copper or iron, does not have any healthy role in the body. Any amount of lead poisoning can produce toxicity, and this toxicity affects many organ systems in the body. The primary toxicity that we see is neurologic, but there are also important injuries that can occur to the hematologic system, to the kidneys, and to other systems as we're about to describe. So the most significant toxicity that we generally see from lead poisoning is to the brain and also to the peripheral nerves. With acute exposure, such as high-dose exposure from smelting or heating lead, or high-dose ingestion of paint chips, say in a small child, the most feared complication is lead encephalopathy. This causes all the symptoms you'd expect of encephalopathy with altered mental status, increased intracranial pressure. This can be a fatal condition. Chronic neurotoxicity from lead exposure is more insidious, but also very dangerous. Some patients will have headaches and changes in behavior. There's a very strong dose-dependent association between chronic lead exposure and lowered IQ, particularly in children, and unfortunately these effects are thought to be irreversible. Lead is also a motor neuron toxin, so it causes a peripheral neuropathy that's a pure motor neuropathy, typically affecting the extensor muscles in the wrists and the feet. So you see foot drop and wrist drop, such as this patient has here. You can also see in this picture a lot of muscular atrophy in the hands because of the denervation affecting the nerves feeding those muscles. On average, a child exposed to lead chronically in childhood will have a 4.6 point drop in IQ for every 10 micrograms per deciliter increase in blood level. So that is a substantial amount. Some children with lead levels even in the detectable to up to 10 range can have a loss of IQ of about 7 points compared to their non-exposed peer.
For hematologic manifestation, in acute form, lead can cause hemolysis. In chronic form, it can inhibit heme synthesis, impair erythrocyte membrane stability, and cause basophilic stippling. This is the heme synthesis pathway. The enzyme that in the red box, delta aminovalunic acid and ferrochelatase, is the enzyme that were inhibited by lead. And the enzyme delta aminovalunic acid dehydratase and activity can be sent to see if the lead inhibit this enzyme or not. There are also a lot of byproduct accumulate in lead poisoning patient, including protoporphyrin in red blood cell, delta aminovalunic acid, porphobilinogen and copoporphyrinogen 3 that excrete in the urine. That can be sent as well. This is the picture of the basophilic stippling in red blood cell. You can see that the red blood cell have the blue dot in it. The basophilic stippling is the degrade DNA that usually be lysed by enzyme called pyrimidine 5 nucleotidase, but lead also inhibit this enzyme that cause the degrade RNA still in the red blood cell and see as the basophilic stippling. Basophilic stippling can see in other conditions as well, but it's going to help on the diagnosis. Besides lead poisoning, it can also seen in arsenic poisoning, hemoglobinopathies, pyrimidine 5 nucleotidase deficiency, G6PD deficiency, megaloblastic anemia, and alcoholism. For renal manifestation in acute form, it can cause lead nephropathy in form of Fanconi-like syndrome. The patient gonna have amino acid urea, glucose urea, and phosphuria. In renal biopsy, you can see the nuclear inclusion body in renal tubular cells. These findings are reversible if the patient was treated and stop the exposure. In chronic form, lead can cause the progressive interstitial fibrosis and impair uric acid excretion and cause patient to have gouty attack called Saturine gout. For musculoskeletal, lead also inhibit bone growth at the metaphysis and also interfere with the calcium deposition. So the bone at the metaphysis did not grow and calcium get in more. So you can see the radiopaque at the metaphysis from the calcium deposition called lead line. This can be found in kids and teenagers. And if it accumulates much enough, the kids gonna have the problem with the bone growth and also short stature. The other symptoms include hypertension, reproductive impairment, infertilities, endocrinopathies. Another most common one is the GI symptom. The spasmodic abdominal pain and constipation is most common symptom that can found in occupational finding. Another mucocutaneous manifestation is gingival lead line, or called Burton line, which is the darkening line on the gum. The carcinogenic effects is reported in animal study only in rat, but no report in human. This is the blood lead concentration in adult and kids and the manifestation. You can see that kids tend to have more symptoms in the same level as the adult. As you can see that the kids tend to have encephalopathy at the level about 7 microgram per deciliters, whereas adult gonna have encephalopathy at the concentration around 100 microgram per deciliters.
So you're probably wondering, what do I do when I have a patient with an elevated blood lead level, or when I'm suspecting lead poisoning? So the workup for lead poisoning is really fairly straightforward. It starts with some things you can get simply: a CBC and a peripheral blood smear to look for basophilic stippling, as my colleague described. X-rays can be helpful. Abdominal X-rays may find paint chips ingested by a child. Long bone films can show lead lines. Again, this is mostly something you do in children. Chest X-rays are sometimes helpful, and if there is a retained bullet, an X-ray can show if that lead is being absorbed into the system. Lead bullet fragments that are embedded in solid bone or that are in soft tissue such as muscle generally will not leach significant amounts of lead. But lead foreign bodies that are in contact with moving bone that's under motion, or in disc spaces that are bathed in fluid, such as in joint space or the spinal canal, can leach significant amounts of fluid. An X-ray will show you whether that lead is staying in put or being mobilized. Nerve conduction studies are also helpful to diagnose neuropathy as opposed to other potential causes of nerve pathology. The linchpin of diagnosis is the whole blood lead concentration. This is done on a venous sample. There are special lead certified or heavy metal certified needles and tubes that should be used, although that's rarely a problem in labs today. Those concentrations are almost always send-out labs, and depending on your send-out lab situation, will take anywhere from 3 days to 2 weeks to come back. Tests that can be done quickly, sometimes even with portable equipment, but that are not as useful, are zinc protoporphyrin levels in red blood cells, ALA dehydratase activity in whole blood. Those can sometimes be used to provisionally rule in or rule out lead poisoning when the differential diagnosis is in doubt. And they actually still have roles in some of the OSHA requirement management for lead poisoning, although generally speaking, if you have a blood lead, these other levels really aren't very helpful. If the question has to do with whole body lead burden, there's a technique called K-X-ray fluorescence, which can be used to measure the amount of lead in bone in a living person without injuring or requiring a biopsy.
For pediatric screening and follow-up, American Academy of Pediatricians and Center of Disease Control and Prevention recommend screening in all children aged at 1 and 2 years old, and also recommend for the kids that older than that and never been screened before. Some local health departments, such as in New York, Chicago, and Philadelphia, recommend screening every 6 months from age 6 months old to 2 years old. When the screening come back, if the level less or equal to 9, the kid's gonna be retest for another years. If the level 10 to 14, retest at 3 months and give the educational. At concentration of 15 to 19, retest at 2 months, give the education, and refer the case for the management. The concentration at more than 20 but less than 44, have the clinical evaluation, give the education, and do the environmental investigation. No chelation at this point. The chelation gonna have the role when the concentration equal or more than 45. And if the concentration more than or equal to 70, you need to hospitalize the children and give the immediate chelation therapies. In 2012, the CDC changed the action number to 5, so the concentration more than 5, you start to do the clinical evaluation and give the education.
Now, as Dr. Strasuma explained, children are more sensitive to lead poisoning than adults, and adults often can tolerate blood lead levels that would put a child in the hospital, sometimes can produce very mild symptoms in adults. The OSHA standards vary a bit depending on whether it's general industry or marine industry or some others, but the general industry standard, which is what applies to most workers, requires periodic blood lead testing in workers who work with or around lead. If the blood lead level is over 40, the worker has to be notified. If it's over 50 on the average of 3 tests or over 60 once, the worker has to be removed from the job until the blood lead level has been measured less than 40 twice. Treatment standards for adults are much more liberal than for children. Generally, we will chelate symptomatic adults or asymptomatic adults with very high levels, but most of the time for adults, the exposures are more chronic, and removal of exposure is the key.
For treatment in acute toxicity, mainly first do the primary survey and stabilization. Give the supportive treatment if the patient seizes or agitates. Give the sedation. And maintain the urine output because it is the main route that you excrete the lead out of your bodies. For decontamination, the gastric lavage may consider if the patient just ingests lead within first hour. For the activated charcoal, lead did not bind to the activated charcoal, so it's no benefit to give it at all. For whole bowel irrigation, it has a role to do the whole bowel irrigation if you detect the radiopaque material on the abdominal X-ray, such as the lead paint chips. And the specific treatment is the chelation therapy that we're going to talk about further. For chronic toxicity, the main treatment is avoidance and stop the exposure. The chelation therapy do only in the case that have moderate to severe toxicities. In case that have iron, calcium, zinc, and vitamin C deficiency, replace this nutritional supplement, gonna decrease the lead absorption through the gut. In case that have retained bullets, do the surgical removal of the retained bullets, gonna stop the exposure. For chelation therapy, we have chelators such as dimercaprol or BAL. This is the IM drug that dissolve in the peanut oil. So before giving this, you need to check the history of peanut allergies. The second drug is calcium disodium EDTA. This is the intravenous drug. The succimer and the penicillamine is the oral drug. The chelation therapy in children that have encephalopathy or the level more than 69, consider parenteral chelation regimen using combining BAL and calcium disodium EDTA. Asymptomatic kids with blood lead concentration 45 to 69, consider using succimer oral alone or calcium disodium EDTA IV alone. In asymptomatic kid with blood lead level less than 45, not recommend routine chelation at all, but you need to stop the exposure. For adults that have encephalopathies or blood lead concentration more than 100, also recommend parenteral combined chelation using BAL and calcium disodium EDTA. For my symptoms that all have the blood lead concentration 70 to 100, using succimer alone or calcium disodium EDTA alone. In asymptomatic adult with blood lead concentration less than 70, no routine chelation recommend. Just stop the exposure.
So, treating lead poisoning, it can be risky and expensive. Prevention is the key. The first thing to do if you have a child with a blood lead level over the level of concern is to notify your local health department. The health departments have educators who can do home inspections to look for sources of lead and can also work with families to help them understand the types of things they can do to reduce the exposure for their children. The most hazardous areas of a home are places where they're peeling or otherwise degraded paint. The most hazardous areas of the yard may be soil if you're in a high lead soil area. This starts with dust control, wet mopping areas frequently, watching children's hands and toys and pacifiers frequently. All children put things in their mouths all the time, and you can't get that to zero, but you want to reduce the amount of lead ingested as much as possible. Soil lead exposure can be reduced by planting vegetation that reduces dust, such as grass and shrubs. In some parts of the country, there is a significant amount of lead in tap water, so only cold tap water from well-flushed pipes should be used in these areas because the stagnant water that's been sitting in pipes for a while has more lead in it. Optimizing nutrition, as Dr. Srasuma pointed out earlier, children who are iron deficient or zinc or calcium deficient will absorb lead more avidly. And sometimes we'll put those children on multivitamin with iron supplements so that the body is not so avidly trying to absorb minerals from the diet and getting more lead as they're at it. Avoid occupations that will lead to lead exposure. So if you are a parent who reloads projectiles or who shoots, you want to keep the children away from the areas where those hobbies are done. And to be very alert to other sources besides the obvious ones in the home. I've had patients exposed with medications sent by their family members from other countries or from cosmetics that were purchased from other countries, occasionally herbs and spices from other countries. So all of these things matter. Our supply in the United States is generally quite safe, but it's a large world. In the workplace, patients or workers who are exposed to lead in the course of their jobs are required by OSHA to have lead exposure monitoring. Anything you can do to improve ventilation will reduce the amount of lead that workers are exposed to. And personal hygiene habits really matter. And it's simple things like no smoking on the job site, because hand-to-mouth behavior leads to a dramatic increase in the amount of lead dust that is absorbed. Requiring people to wash their hands before eating, drinking, or smoking to get dust off the hands, again, because that hand-to-mouth behavior is a source of lead exposure. When lead is heated, regular dust masks won't be adequate and more formal respiratory apparatus is needed. And having people who are in heavy lead industries change from their work clothes and shower before leaving the work site helps protect them personally and also their family from lead exposure.
In pregnancy case, the lead can freely pass through the placenta and accumulate in the fetus. There's a case series and literature reviews of using the chelators. It's found that the chelators did not association with the birth defects. So you can do the chelation to the pregnancy case. But the chelation have limited efficacy for the fetus. So treat the mom and assess the fetus later. Lead can go to the breast milk and being the route of exposure in infant. So we recommend check the lead concentration in milk and stop breastfeeding until the lead is decreased in the milk.
So just to wrap things up, lead is common in everyday life. It's a very useful mineral and still has its place in our society. The toxicity of lead is mainly because it impairs the function of certain enzymes that use calcium and zinc in their pathways. Lead is a multi-organ toxin, but the most important toxicities are to the brain, the peripheral nervous system, and the bloodstream. And the mainstay of treatment is prevention, and if prevention has failed, then removal from exposure along with chelation therapy. So thank you for spending your time with us. Again, on behalf of the Rocky Mountain Poison and Drug Center and the Pediatric Environmental Health and Specialty Unit, Rocky Mountain, thank you very much for your time and attention today.